Good afternoon, guys. I have discussion C for you. We are discussing how New York requirements threaten millions of older Americans for people to receive food stamps. That is what we're going through this afternoon for C requirements that government has changed that people must meet for them to receive food stamps. Here's the narrative that I wrote for you. Title: The Quiet Hunger. How New York requirements threaten millions of older Americans. The trouble began quietly, almost bureaucratically, a line in a federal rule, a shift in eligibility, a new requirement tucked into a policy brief. But for millions of older Americans, the consequences are anything but quiet. They arrive in the form of empty pantry, a skipped meal, a rising sense of dread, hunger rarely announces itself with drama. It creeps for 62-year-old Marlene. The letter came on a Tuesday. She had been receiving SNAP benefits for years. Not much, but enough to keep her cupboards stocked with oatmeal, canned vegetables, and the occasional bag of frozen chicken. Her arthritis made standing for long periods nearly impossible, and her part-time job at the local laundromat had ended when her hands could no longer fold sheets. She assumed her benefits would continue. After all, she wasn't young. She wasn't able bodied. She wasn't someone the system expected to work. But the letter said otherwise. Under new federal rules, adults up to age 64 must now meet strict work requirements, 80 hours a month of employment, volunteering, or job training to keep their food assistance exemptions that once protected older adults with health limitations have narrowed. States have lost flexibility to waive requirements in regions with high unemployment, and the clock has begun ticking. 3 months to comply or the benefits stop. Marlene read this letter twice. She didn't know how she was supposed to work 80 hours. She didn't know how she was supposed to volunteer when she couldn't stand for more than 10 minutes. She didn't know how she was supposed to get a job training site when the nearest bus stop was 2 miles away. She did know was that she had $14 left in her checking account and a half emptied refrigerator. She was not alone. Across the country, millions of older adults, people in their late 50s and 60s, many living with chronic illness, disability, or caregiving responsibilities, are being swept into a policy designed decades ago for young, able bodied adults without dependents. The new rules do not distinguish between a 58-year-old with congestive heart failure and a 25-year-old marathon runner. They do not account for the realities of rural America. Where jobs are scarce and transportation is a luxury, they do not consider the quiet, grinding truth that aging itself is work. Work the body does without permission, without pause. The consequences rippled outward. Food banks report surges in demand, especially from seniors who have never asked for help before. Health systems see rising rates of malnutrition, uncontrolled diabetes, and preventable hospitalizations. Families stretch themselves thinner, sharing groceries, skipping meals, or taking on debts to keep aging parents fed. Hunger becomes a shared burden, a shadow that follows everyone in the household. Policy analysis warn that more than 1 million older adults could lose SNAP benefits under the new requirements. The Congressional Budget Office projects millions more will fall off the rolls entirely. These are not abstract numbers. They are people like Marlene, people who worked for decades, raised families, paid taxes, and now find themselves punished for the simple fact of aging. Supporters of the new rules argue that work requirements encourage employment and reduce dependency, but for older adults, the logic collapses. You cannot incentivize work where work is not possible. You cannot demand productivity policy on the assumption that everyone ages the same way. What these requirements reveal is a deeper question. What society owe its elders? Is food reward for labor or a basic human right? Do we measure worth by hours worked or by the dignity with which people are allowed to live? For Marlene, the answer came in the form of a neighbor who brought over groceries, a church pantry that offered canned soup, and a social worker who helped her file an appeal. But she knows these are temporary solutions. She knows the system has changed in ways that do not see her, do not understand her, do not value her. The hunger crisis facing older Americans is not loud. It does not make headlines every day. It does not spark outrage in the way other national debates do, but it is real and it is growing. And unless the country reconsiders what it is asking of us, ask what it is or what it asks of its elders and what it owes them, millions more will face the same quiet fear Marlene felt when she opened her letter. Hunger is not a policy failure, it is a moral one. Okay, now, guys, I'm going to do the second half of this presentation. In the state that I live, I did a narrative for that one too. So I'm going to read this. This one is focused on Pennsylvania, okay, as a speech. Okay, here we go. Chair members of the committee and fellow Pennsylvanians, thank you for the opportunity to speak today about an issue that is quietly reshaping the lives of thousands of older adults across our Commonwealth. I want to begin with a story because policy becomes real only when we understand the people it touches, the human impact. The trouble began quietly, almost bureaucratically, a line in a federal rule, a shift in eligibility, a new requirement tucked into policy brief. But for older Pennsylvanians, the consequences are anything but quiet. They arrive in the form of an empty pantry, a skipped meal, a rising sense of dread. Hunger rarely announces itself with drama. It creeps. For 62-year-old Marlene, a resident of northwestern Pennsylvania, the letter came on a Tuesday. She had been receiving SNAP benefits for years. Not much, but enough to keep her cupboards stocked with oatmeal, canned vegetables, and occasional bag of frozen chicken. Her arthritis made standing for long periods nearly impossible. Her part-time job at the laundromat ended when her hands could no longer fold sheets. She assumed her benefits would continue, but the letter said otherwise. Under new federal rules, adults up to age 64 must now meet strict work requirements. $80 hours a month of employment, volunteering, or job training to keep their food assistance. Exemptions have narrowed. State flexibility has diminished, and the clock has begun ticking. 3 months to comply, or the benefits will stop. Marlene read the letter twice. She didn't know how she was supposed to work 80 hours. She didn't know how she was supposed to volunteer when she could stand when she couldn't stand for more than 10 minutes. She didn't know how she was supposed to get a job. Training site when the nearest bus stop was 2 miles away. She didn't know she did know she what she did know was that she had $14 left in her checking account and a half emptied refrigerator. She is not alone. Pennsylvania's demographic reality. Pennsylvania is the 7th oldest state in the nation. Nearly 1 in 4 residents is over 60 in rural counties. Crawford, Venango, Warren, Potter, Forest, that that proportion is even higher. These New York requirements do not distinguish between 58-year-old with congestive heart failure and a 25-year-old marathon runner. They do not account for realities of rural Pennsylvania where jobs are scarce. And where transportation is a luxury, they do not consider the quiet, grinding truth that aging itself is work. Work the body does without permission, without pause. Older adults who want to comply often cannot. Rural infrastructure makes compliance impossible. In northwest Pennsylvania, the nearest job training site may be 30 to 40 miles away. Public transportation is limited or non-existent. Volunteer opportunities are sparse. Broadband gaps make our tracking and documentation difficult. The work requirement image imagines a world where opportunity is around the corner. Rural Pennsylvania lives in a world where opportunity is often an hour's drive away, and the car broke down last winter. Health system consequences. A physician, I see the clinical consequences of food insecurity every day. When older adults lose SNAP, they lose glycemic control, muscle mass, stability or chronic disease. Stability in chronic disease. The ability to age safely at home. Hospitals, especially rural ones, will see more emergency visits, more admissions for preventable conditions, more long-term complications, more reliance on Medicaid. The cost of hunger will not be borne by the federal government. It will be borne by Pennsylvania's health systems, taxpayers, and caregivers. Pressure on food banks and senior centers. Pennsylvania's charitable food network is already stretched thin. Senior centers church pantries, and community organizations cannot absorb thousands of newly food insecure older adults. Charity is not a substitute for federal uh, entitlement programs, and hunger is not a problem we can volunteer our way out of. Threat of Pennsylvania's aging in place strategy. The Commonwealth has invested heavily in aging in place programs, share housing, caregiver support, community health choices, home-based services, all depend on stable nutrition. When seniors lose SNAP, they decline faster. They enter nursing homes earlier. Medicaid costs rise. Independence is lost. The work requirement undermines Pennsylvania's long-term care strategy. What Pennsylvania must do now? While we cannot reverse federal law at the state level, we can mitigate the harm, expand exemption outreach so seniors understand disability, caregiver, and health-related exemptions. Strengthen rural transportation to help older adults reach job training and volunteer sites. Increase senior nutrition funding through area agencies on aging. Support county assistance offices with staffing and administrative resources. Document statewide impacts to inform federal advocacy. Protect aging in place programs from downstream destabilization. These steps will not eliminate the harm, but they will prevent the worst outcomes. Closing message. The SNAP work requirements are not a question of motivation. It's a question of feasibility. Pennsylvania seniors are being asked to do the impossible. We must act to prevent hunger, protect independence, and safeguard the health and dignity of older adults. Hunger is not a natural consequence of aging. It is a policy choice, and Pennsylvania can choose differently. Okay, guys, that is C for you. I will be back on with D shortly. Give me a bit for that, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.